And now that first patient is stabilized, so you'll have to go and talk to the other two patients. So in this case, we're going to pretend I just brought that person in, I sent off my information, the patient is now in a delayed category because we put a tourniquet on. Now I'm going to go visit my other two patients. All right, hey buddy, are you body substance isolation? Hey buddy, are you okay? What's going on? And while you're doing this, that's when you do your quick, I'm just looking for blood, just tell me, how's everything going? What's going on? Oh, my stomach hurts. All right, don't worry, I'm going to check it out in a second. Now I've performed my initial blood sweep, right? Or I've looked for extremity hemorrhage. So, all right, no problem. I'm going to check it out, and they're going to be just like this, where they're only going to be Velcroed, or it may be zippered. I doubt it because they're going to have the moulage in place. So, oh, look it, I'm exposing the wound, and there's an external. There's a what do you call it? A big mound of guts. So, wound is exposed.
Place the casualty on his back, face up, let's the casualty seize after the casualty assessment is completed. Turn the casualty's head to the side and keep the airway clear if vomiting occurs. Number 3, expose the wound. Number 4, apply a sterile abdominal dressing.
Okay, so let's stop here. In the scenario I was talking about where there are going to be 3 patients, once you perform these tasks, this patient is now in a delayed category. So then, bless you. So now you go to your next patient and evaluate your next patient, and we'll cover that later. But in this case, we're going to continue on with this one patient. So we've exposed the wound. Taken BSI. We've performed our blood sweep. We've talked to the patient, asked what's going on. They said their stomach hurts. We exposed the wound. We see the eviscerated organs. We flex the knees, turn the head to the side, and reassure the patient. Now,
apply the sterile abdominal dressing. Place the dressing directly on top of the wound.
Okay. All right. So there are 2 types of dressing that you may have out there. One is this really nice emergency trauma bandage or emergency trauma dressing, which they should have because this is now the standard. The other is the old World War II style abdominal dressing. Now remember, we're working with medlock, so you could have either, and we're going to cover either just in case, because this is what I had when I went out there, and then, well, to the medlog site, and then at the other sites that I visited, they had these. All right, so let's work with this one first. You see, this one has all these nice little ties coming off of it. It even reads, "Put other side next to wound." So when you open it, it'll be folded in a paper bag inside of a plastic bag, just like this. Well, the ties will be all, the ties will be fan folded on each side. So when you open it, the ties will be nice and compressed, and you'll pull them out. You'll open up the wound. Now notice that they come off top and bottom. Make sure that goes like that on the patient. If you put it like this, then it's pulling the dressing off to the side, so you may have an exposed portion, okay? So we're going to carefully open up the dressing, making sure not to contaminate the white side. We're going to place it loosely on the abdomen.
Okay. Secure the dressing loosely, and then dependent on the type of the abdominal dressing being utilized, tie and the dressing tails loosely in a non-slip knot at the casualty side if applicable.
Okay.
Do not apply pressure on the wound or expose internal parts.
Okay. So, like I said, we're going to place this on the site. If it's probably going to be necessary to hold it in place, I suggest holding it above the wound or below the wound so it doesn't slide side to side. But whichever you do, make sure you say, I'm placing this dressing loosely on top of the abdomen, and I'm not applying pressure as I do this. Now you take your ties, ball them up, put them here. Now remember, the patient's not going to move side to side because they have eviscerated organs, so they're going to be sloshing back and forth. If this is a live casualty, what you can ask them to do is, hey buddy, bow your back a little bit, okay? If it's a mannequin like this, which they may have, because they didn't request too many people, you're just going to have to stick it underneath there. So grab a fistful, make sure you have the slack, and reach through. Do the same thing with the bottom, or you can put it under the buttocks and then ride it up. These have to go back to the other side as well. Now, there are going to be, they have a bunch of different mannequins out there. They'll have a mannequin like this, which is like, you know, active duty mannequin. So it weighs about 140 pounds total. This one actually probably weighs a little less. Then they'll have reserve mannequins, which weigh about 160 to 180. Then they have National Guard mannequins, which are going to weigh in excess of 180 pounds. So hope that you have the active duty mannequins. All right, now that we have the ties under the patient, we're going to wrap around, making sure to cover the white and tie off to the side in a non-slip knot. All right, continue.
Okay, if 2 dressings are needed to cover a large wound, repeat steps 3A and 3B. Ensure that the ties of additional dressings are not tied over each other.
All right, now in addition to that, what I want to emphasize is, remember how last week with the ITB or the ETB, we covered making sure that the whole dressing was covered with the wrap as we come around. With this one, it's not going to be possible because we have this exposed off to the side. So you want to make sure it's loose. You want to make sure that this isn't very tight, but you do want to make sure that it covers the white of the dressing. And you want your bandages to be covered, or your knots to be on the same side in a non-slip knot. Okay, knots are tied. The dressing is loose, or it's loose, and not restrictive, but it will hold the bowel in place. And the knots are non-slip knot on the same side. You could also take and tape or tuck or tie the tabs, that way they're not loose.
Okay.
Oh, I'm sorry. One second.
Sorry. When it comes to the non-slope knot, how can you? I mean, never done one, so.
Aren't you in the Navy? Isn't that like something they teach you?
I'm just different knots.
All right, we'll cover knots later.
Okay, just want to make sure. I just don't want to get disqualified for it.
All right, what's next?
Okay, if necessary, loosely cover the dressings with cravats. Tie them on the side of the casualty opposite that of the dressing ties.
All right, is that all?
Yes, Sergeant, and did not cause further injury to the casualty.
All right, so did not cause further injury to the casualty. So everyone saw how I did this, right? Very easy. This is one of the easier tasks. Basically, all you have to remember is BSI, don't push, and cover the white on the top and bottom and tie on the sides. That's all. Didn't say anything about kicking the canteen away?